Wisconsin has more than 93,000 registered nurses.
They are the largest healthcare profession in Wisconsin.
Many of them were shocked when the Trump administration announced that the Department of Education would be removing nursing from its list of professional degrees.
I guess appalled would be a good word given what's going on in healthcare these days and the important role that nurses play.
Gina Dept heads the Wisconsin Nurses Association and has 40 years of nursing experience.
It has become an emotional issue for all of nurses to be labeled or to think that they're being perceived as not a professional.
But on its new Myth versus Fact page, the Department of Education debunks the idea that it doesn't believe nurses are professionals. It says, quote, "The definition of a professional degree is an internal definition used by the department to distinguish among programs that qualify for higher loan limits, not a value judgment about the importance of programs. It has no bearing on whether a program is professional in nature or not." The new classification lowers federal borrowing limits for nurses seeking advanced degrees, so a master's or a doctorate. Students getting a professional graduate degree, like medical, law, and theology students, to name a few, can borrow $50,000 yearly. Those graduate programs not under the professional designation, like nursing soon will be, can only borrow $20,500 yearly. But data shows that the average cost of an advanced nursing program sits at $30,000 a year. Dept believes the change would make some students think twice about pursuing a higher degree. That's a problem, she says, because advanced practice nurses are filling the holes left by the state and nationwide physician shortage. She believes it could potentially impact care in the years to come.
Patients will probably have to travel further, right, to get to a healthcare system. You have a number of nurse practitioners that are working in the emergency room. If they're gone and the physicians are gone, what will the impact of that care be? Delay.
But the dean of nursing at Concordia University, Wisconsin, says she believes those who are called to be nurses will still pursue those higher roles.
It takes a special person to want to be a nurse. So I don't think there's going to be a decreased interest. I think where we're really going to have to rally our troops is in education of these additional funding mechanisms.
She does have concerns, however, about future nurse educators who could be hit hard by aid caps. She says it's a field that's already strained.
Statistically speaking, there was over 60,000 nursing students that were turned away, qualified nursing students with interest to be a nurse. That were turned away because there were not enough nurse educators to teach them.
However, leaders at Concordia say they're confident that thanks to its financial aid office, donors, and university partnerships, they can help mitigate the impact of the new borrowing limits for those affected. But the school does plan to start its classes a week early next year, just before the new borrowing limits take effect on July 1st.
I think is when you have legislation come down like this and such a short time frame, the more students you can grandfather into the old limits allows us and any school more time to come out with a plan that's best for students moving forward.
Kevin Sheridan is Concordia's Assistant Vice President of Financial Aid. Overall, he says the funding changes will have the biggest impact on first-generation college students and put more on admissions and financial aid teams.
The change to the Graduate Plus loan is honestly going backwards in time, before 2008 when it didn't exist.
But he stresses that this doesn't mean that these degrees are out of the question.
Schools are still fighting for students. Accrediting agencies are still fighting for students. We're going to walk with students, meet them where they're at, and walk hand in hand trying to help them afford their education.
Marlo Lundak, Fox 11 News.